I am Sarah Lubert. I'm the executive director for the Missouri College of Emergency Physicians, and we're very excited to have you here tonight. This evening, we have Dr. Mark Mendelson to give us a presentation on advocacy. Dr. Mendelson received his BA in biology and philosophy at Brandeis University. He then went on to get his medical degree from Stony Brook University School of Medicine in Stony Brook, New York, and then completed his residency. Dr. Mendelson, you'll have to help me with that one.
It's a New York Presbyterian, Brooklyn Methodist.
Perfect. Wonderful. Thank you so much. Dr. Mendelson sits on the MOCEP Board of Directors. He also is very active with the AMA and the Missouri State Medical Association. So, Dr. Mendelson, I will turn it over to you.
All right, guys, nice to meet you all. Welcome. And I was asked today to talk just a little bit about how to be involved in advocacy as a physician. And I'll talk a little bit about how that relates to my time at MOCEP, but I'll also talk more generally than that. But I think that in order to really uh, talk about advocacy, I think we have to talk a little bit about health policy and sort of what that means. So if you give me a second, I'm gonna try to share. We're going to see if this is going to work. I'm going to try to share just a part of my screen so you guys can see the slides without like everything else being annoying.
That
All right. Does that work? Can
mostly
you guys see
looks
the
good.
slide? Does
Yes.
that work?
Actually, now we're seeing
Looks
it
good
just
now?
has something. Yes.
Perfect. All right. So, like I said, my name is Mark Mendelson. I'm an emergency physician. I'm at WashU in St. Louis. Um, and what we'll talk about today is obviously advocacy. And the things that we'll sort of talk about is we're going to cover why does health policy matter, the difference between politics and policy. Then we'll get into the meat of what we're talking about today, which is Advocacy 101. And then we'll talk a little bit about what that might look like over the next couple of years. Probably without too many details, but we'll talk about it a little bit. So the first question you should always ask yourself when you start to hear a talk is, why should you listen to this person? So Sarah already did a good job of telling you a little bit about my background. In addition to my emergency medicine residency that I did in New York, I did a 2 year health policy fellowship down in DC. And while I was doing that, I worked clinically as an attending for GW, but I also earned my master's in public health. And I also got to do a number of pretty cool health policy related activities. So I lobbied with ACEP, which is the American College of Emergency Physicians, in Congress. And then I was on the Hill in a congressional office as a health aide for 6 months. It was very, very busy because I was working almost full time there and then also had to do my hours in the emergency department on the weekends. But it was great. As you can see from the photos, I have a growing family. I have 3 kids. My wife is also in medicine. She's a GI doc, also at WashU. Um, we actually met at a medical student conference when we were medical students. We went to different medical schools. So all the more reason to be involved. In any case, I do have some expertise both in terms of understanding how health policy works because of working in DC, and then also as an advocate, just going to talk to my legislators in DC, in Jefferson City, here in Missouri, back in New York when I was a medical student, going up to Albany. And all of those things sort of lend themselves to being able to advocate for yourself and your patients moving forward in your career. So, why does health policy matter? Well, why did you go into medicine? I'm sure that the vast majority of you did not pick medicine because you thought you were going to make a lot of money and be rich. I know that that was the case for a generation of physicians before me. Um, and you will certainly have a very comfortable life as a physician in terms of the amount of money that you're making, but you're not going to be like the wildly, most impressively wealthy person. Um, Most of us went into medicine because we wanted to make a difference. You liked science, someone in your family was a doctor, someone you knew one time who you saw do something cool was a doctor, but you wanted to make a difference, and that's why we're here. And health policy can often make a bigger difference than we can one-on-one with our patients. So, why does health policy matter? Why do we care? Up on this slide, there are a whole bunch of things that affected me in the emergency department a lot, but they affected doctors in all different fields. I don't know if any of you know what any of these things are, but I'm going to talk about them just a little bit. Some of them are gone, some of them still exist. The first one is the 2 midnight rule. This was a rule that basically said if someone was admitted to the hospital and they were discharged before two midnights had passed, then Medicare, Medicaid would not pay for them to be in the hospital. This is a horrible law. Like it was a regulation, actually. And what happened was people would then preferentially start admitting people at like 10 p.m. or 11 p.m. so that you'd get admitted before midnight so that you could stay for 24 hours or 25 hours and then you could be discharged and you would get paid. Whereas if they were admitted at 12:01, you'd have to stay for that whole extra 24-hour period in order for Medicare and Medicaid to pay. Now, there was a lot of advocacy on behalf of physicians and hospitals in order to get that sort of taken off the books. EMTALA, you may have heard, that's basically the law that makes it so that emergency departments have to treat people who come in. So anyone who comes into the emergency department, regardless of your ability to pay, gets seen, gets screened, and gets any emergency care that they might need. The ALA at the end is End Labor Act, so it also applies to pregnant folks. I'm not going to go into any of the details, but in like the 1970s, people would come to the emergency department and they would either get like transferred out to like county hospitals if they didn't have insurance or they didn't have money, or they would just be told, sorry, you can't be seen here. And so this law came to sort of counteract that. This is like a good law that we actually need. REACH, you probably haven't heard of. It's a national program administered by the CDC. It still exists. They still have a web page. It's it's basically to reduce racial and ethnic health disparities. And the CDC has been doing this for 25 years. So 2024 was the 25th anniversary of this program for the CDC, and this was like a huge win for like health advocacy and for health policy. And hopefully, it's going to continue moving forward. There have been numerous over the years guidelines related to sepsis and pneumonia that caused no end of problems for physicians and people taking care of patients because there would be all these crazy rules you have to follow that didn't help us take care of patients, but requires charting and requires you to do certain things, even if it's not in the patient's best interest. So, for example, one of the things that has changed is it used to be that if someone came in with sepsis and you did not give them a 30 cc per kilo bolus of fluids, you would get dinged on the amount of money you could get paid based on how many times that happened. Doesn't matter if the patient was fluid overloaded from heart failure. If they dinged for sepsis and you didn't give them 30 cc's per kilo bolus, doctors would get in trouble. You would not get paid. Hospitals would not get paid for not following that. That's been cooled down a little bit. Now we have ways around it with certain language we can use. But all of that was a result of advocates standing up for things that made no sense and to make a change, talk to legislators, get things either through legislation or by talking to regulators to get just the regulations changed without having to go through the legislative process. So, what are the differences between politics and policy? Um, I like trying to give this lecture in person because I can actually make you guys answer, but I think it's probably a little bit too difficult on Zoom to start randomly calling on people. So we'll zoom through and we'll go through a little quickly through some of these parts. But long story short, policy is the actual meat of what we care about in advocacy. You kind of put together your values, politics, facts, which hopefully come from science, and all of that comes together to generate policy. Whereas politics, on the other hand, can be any number of things, but a lot of times it has nothing to do with healthcare and nothing to do with what we want to do for our patients. I'm not going to read off all the like little things on these slides. You guys can read them. I trust that as medical students, you are perfectly capable of reading it in the amount of time that I'm talking. So I'm not going to go through all of it. I do want to sort of make an important point that policy is not only in legislation and regulation on a governmental level, right? But there's also policies that occur on a local level as well. So the WHO, which is the World Health Organization, states that health policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. And it goes on to talk about that a little more. The World Health Organization, which we were formerly a part of, but are soon to be no longer a part of. So where does health policy fit in terms of like public health, in terms of the physical health of patients, in terms of what we do in providing healthcare? Well, it's kind of the overarching schemata that we use to take care of patients, right? So the broad strokes of public health policy um, regard how we take care of patients in mass on a whole, and then there's individual policies that govern how we take care of patients individually. I will make a plug for all politics being local and all policy being local. So after finishing my fellowship, I went back to New York and I worked as an attending for a year while my wife finished her MD PhD. So I worked at a small, well, not small, but I worked in an emergency department in New York City where I don't know how many of you have had a lot of time clinically, but depending on where you work, there are clinical areas where you're not allowed to have food and drinks, meaning like the doctor can be working there for most of their shift and like not be allowed to have a sandwich or coffee or whatever it is at the workstation because of regulations that are local, right? This is not caused by OSHA. It's not caused by JCO. None of those like big acronym names of things that you've heard people talk about. None of them make that rule. All of those rules come down to the local institution. And so I got there and I wasn't allowed to have coffee when I was working a like 12-hour shift in the emergency department. And as you can tell from my hair right now, I need coffee at all times to survive. And so it made it my mission during my 11 and a half months of employment there to change it. And I was able to affect that change. And so we got to post these signs all over the emergency department, wherever the doctors were working at our computer stations, that we're not going to have samples here. We are going to eat and drink here. And you can make a difference even if you're not talking about globally or by talking about going to Jefferson City or talking about legislators or talking about how we take care of patients. You can make a difference in where you work by affecting the policies that will affect you and your colleagues and your patients. And that's advocacy too, right? Standing up to policy and making a change is advocacy regardless of the location. And with that, we will start talking about actual advocacy. So many people have different definitions of it. I'm not going to try to define advocacy. Instead, what I think might be useful is I'll talk about the different ways that we have to engage with advocacy. So, what can you do? What can I do? What can we do together to engage in advocacy, to stand up for things that we care about in healthcare, for our patients and for our profession? So, there's four main ways, like sort of big, broad strokes ways of looking at advocacy. There's grassroots, there's just contact, so like writing letters, making phone calls, talking to like legislators, for example, or other people who have the ability to change regulation. There's grass tops, and then there's sort of like op-eds, which is like talking to the public. And we'll talk about each of these things just a little bit kind of as we go through. I don't know if you guys are all familiar with grassroots and grass tops. I figure most of you have probably heard of grassroots advocacy before. Um, and so we'll start with that one. So, grassroots advocacy uh, is basically ordinary people being the basis of the movement. The most important distinguishing characteristic of grassroots, as opposed to like grass tops or any of the other ways to be involved in advocacy, is that it is bottom up advocacy. It's collective action at a local level that can then affect change. And the change can be local, the change can be regional, the change can be national. But the point is that it starts at a local level because that's the only way that you can do this bottom up kind of movement. Um, Protests, marches, sit-ins, those are all the kinds of things that we think of when we think about grassroots advocacy. There's different in each state. So, like in Missouri, over the last year or two, we've seen impacts of grassroots advocacy in terms of some of the things on ballot initiatives, right? So, we passed a ballot initiative twice in the last 5 years to expand Medicaid. And the second time they passed the ballot initiative, they finally started to do it. We passed a ballot initiative just this past year to stop the ban on abortion care in Missouri, right? Those are all things that are sort of grassroots. There's organizations that helped to spread the word, but it started from like a large amount of people at a local level reaching out to bring and make change. So if you want to get involved in letter writing or making phone calls or talking to legislators, there are two things you need to do. One is you need to know who your legislator is. And you can do that either by following the link or using that top QR code. It's a US government website. If you type in the address where you live, and it does have to be the address where you're registered to vote, um, then you put in that address, it'll tell you who your legislators are, including the local level ones for the federal government. So like your representatives and your senators. And then the bottom link is actually just sort of it's the Committee of Concerned Scientists. And so it's basically a group of people who put together this like guideline on how to have a productive phone call conversation with a legislator or a regulator because it's not always the easiest thing. And we'll talk a little bit about that. But if you have a minute, if you have your phone, feel free to use those QR codes to save the addresses, just because I know that clicking on links is a pain in the ass. I'll leave them up for another like 5 seconds and then we'll go to the next one. All right. So when you're making phone calls, the most important thing, and again, this is taken from that website, uh, know what you need to know, right? So know your facts. If you don't know the basic information, like basic questions about the topic, then you're not going to have an effective phone call. You want to be able to talk about the topic from your personal lens and give them your opinion and tell them what they should be doing, right? So you need to have a like data and information, and you need to know what you're asking for. Um, you should tell them who you are. Being a medical student, I know it like seems like you're at the bottom of the totem pole, but when you're talking to a legislator, like that has clout, that has meaning, that's something that they care about. If you have other experience from outside of that, talk about those things. Tell them about the fact that you live in the district and how it affects you in your local area. These are all things that establish credibility. These are all things that help to establish rapport with the people that you're talking to. Don't take too long. They're going to have a huge number of these things, a huge number of phone calls, huge number of in-person meetings. So try to keep it short, but make sure you're giving them the information that you need. Um, you always want to talk about topics that are important at the moment. So they can be the most important topic, but if the bill that you're talking about is not being voted on in the next week or two, it's probably useless to make phone calls, right? So you need to be timely. You need to talk about things that are either coming up for votes soon or are currently in the news, right? So it needs to be something that's going to capture the legislator or the regulator's mind and the aide's mind, which means it has to be something coming up or it has to be something that's really, really popular at the moment. Um, and that's mostly it. You usually when there's votes, you want to call the Washington office, but you can call local offices for things that affect you also. And especially if it's a specific issue to your locality, the local office is sometimes even a better place to get in touch with people. And the staff is more junior, which means that they're going to be more likely to give you more time to talk with them about something. Um, on the website that I gave you the QR code for, there's a whole lot more information. This is just like the super, super basics for you. So grass tops. So grass tops is almost the opposite of grassroots advocacy. It's when you get like a lead or a spokesperson to be your face. I don't know if you guys like know all of these people. So Jenny McCarthy is pretty famous for being big anti-vaxxer, and this is like before COVID. This was like even before the new anti-round of anti-vaxxers. You might know Charlie Sheen and Magic Johnson. Both have been pretty outspoken advocates for HIV funding and HIV care. Angelina Jolie did a lot of like fundraising and awareness for breast cancer. Michael J. Fox for Parkinson's. There's a ton of these people who sort of are the face of specific either illnesses or issues. And getting involved with them is a great way to draw attention to something that you care about. Um, Obviously, that's usually not you right now, but if you're involved in organizations, you might know someone. You might have a friend who's sort of famous. You can get involved in issues that you care about. And that is good advertising and also just a good way to get people to look. And a lot of times, education is the most important part of what we do in advocacy. Teaching someone who has a say in what happens about the realities that are happening on the ground is unbelievably important and effective for advocacy work. And then the last one, so we talked about grassroots, we just talked about grass tops, we talked about like phone calls. I didn't really talk about letter writing. Most of the time, for most big issues that are going to face you in your career, one of your groups, so whether it's your specialty society, your state society, or the AMA, will generate like these pre-built letters to send to your legislators, and you just edit them a little bit to talk about how it affects you personally. So there's always the opportunity for that. You can write your own too, but for big issues, you'll have access to those types of resources. But the other place that you can sort of have an impact and get your opinion out there is by writing op-eds for like a newspaper or for like an online publication. Um, Op-eds in general are short, so like less than 750 words. It is an opinion piece by definition. And so you're not trying to do a balanced argument. You are simply trying to express your argument and then give some counter, right? So you're going to give some of the opposition to your argument. And then you're going to want to obviously, destroy that argument and pound it into the ground with all the important things that you have to say. You need a lead or a hook for your story, which basically is like why people should be interested in it. And that has to be in the first like 3 sentences is where your lead has to be. You have to have someone hooked in your op-ed in the first paragraph. Those first couple sentences has to relate to people broadly so that they're going to want to keep reading it. So they're going to publish it. You can't write with like a ton of jargon. So just like when you practice talking with patients and they say you need to make sure you're talking at a level they can understand and not using advanced medical jargon. The same thing goes for these op-eds or opinion pieces that you want to write. You have to write for the common person who's reading it. And then just like when you're calling up legislators, you want to pick something that's timely. And if you do these things, you can get published right now. Um, if you don't know what op-ed means, it's not opinion piece. Op-ed stands for opposite the editorial column because there used to be an editor's column, and then the op-eds would be on the other side of the page in old print newspapers, and that's where the name comes from, even though they're all opinion pieces. All right, so we've talked about why health policy is important. We've discussed different ways to be involved in advocacy, four different main ones, and now we're going to talk a little bit about what we're looking forward to in the future. So as we come through 2025, we have a new Congress. We have a new president who's old again. Healthcare reform or re-reforming is going to be on the table. Vaccines are going to be on the table. Opioids and substance use is going to be on the table. Abortion and women's health are going to be on the table. These are all issues that are going to come up in government, definitely in Missouri, but also nationally over the next little bit of time. Um, we may deal with gerrymandering. They redid all the districting a couple years ago, maybe 4 or 5 years ago in Missouri, but it's going to happen again at the end of probably 2019. So probably 5 more years, they'll be doing that again, right? Where they readjust all the districts to make it easier to get the people that want to stay in power. Um, there are a million issues that are going to come up. I don't know the ones that are important to you, but there's going to be some that are going to speak to you more than others. And the only way to make a difference on a global scale or on a regional scale or on a national scale is to be aware when they come up and to use your voice as a doctor. And I'm not saying you need to like put up signs in your practice. I'm not saying you need to talk to all your patients about it. But you should talk to your legislators about it and you should talk to your friends about it. And you should be involved in things outside of just clinical medicine. It's important for like preventing burnout, right? Having something to do outside and also just for feeling you're more in control, right? Clinical medicine is as there's fewer and fewer private practices, the vast majority of you are going to be employed physicians. I'm an employed physician, which means you're going to have less control over your day-to-day work than the physicians of our past used to. And one way to sort of keep a handle on that is to be involved in advocacy work. Um, the last round of stuff is just so I assume that you're all members of ACEP or MOCEP since you're on this phone call. If for some reason you aren't, then here are links to join all of the different organizations. So MSMA is the Missouri State Medical Association. That's in the top left of the screen. You may not be a member of that, but you should be. They are pretty conservative, but the more young people and students who join and show up, the less conservative they will be. Directly under that is ASAP. Again, that's the one that I'm hoping slash assuming most of you are all members of, since this is the MOCEP, since this is the MOCEP talk. So you should be a member of ASEP if you're a member of MOCEP. But if for some reason you're not, that's how you join. The American Medical Association. So in DC, the AMA has the most clout of any doctor group by far. Um, and they are a membership group in the sense that the only way to have a voice at the AMA is for your state or specialty society to be represented there. And the way that you get represented there is by they count the number of people who are members of the society who are also members of the AMA, and that's how you get representation. So, like emergency medicine has 7 votes in the House of Delegates at the AMA, but that's because there's a lot of emergency doctors who are members of the AMA. You guys need to join to keep those numbers up so we don't lose our voice in the House of Medicine. The other things that are on here in the top right corner is voter registration. So that's for Missouri. So if you're in Missouri and you're going to be here for a little while, which you might be, and you're not registered to vote, that's how you register to vote in Missouri. And then that bottom right QR code is actually just my contact information if it's easier than writing it down. I hope it works. I'm not totally sure it will, but that's there if you need it as well. Um, I know this was like a lot of information. I usually try to have much more interaction when I'm giving these kind of lectures live. It's a little bit hard on Zoom, especially at 5:30 at night. But I do want to make sure that if anyone has any questions, I give you a little bit of time to ask questions. And if not, I would love to, if you guys can. I know that everyone is there with their cameras turned off for the most part, but if you can, I would love for you to turn your cameras on and maybe like we'll go through and everyone can just say like where they're in school and where they were before Missouri. And I'm not in school, but I work at Wash U. And before Missouri, I was in mostly New York, although I also briefly lived in DC and briefly lived outside of Boston. I'm gonna just call on people whose cameras are on, and then we'll go through to the next one. So I think Philip Bricky, you're next.
Hey, so I'm in the Kansas City area, UMKC. Before that, I was still in Missouri, over in the St. Louis area. So
Cool. Nice to meet you. Welcome. Like I said, we'll
yeah.
have lots of time for questions. We're gonna do names first and then questions. Uh, oh gosh, I apologize in advance when I butcher everyone's names. Tanvi,
Hi, yeah, my name is Tanvi. I'm a student at UMKC and I'm from St. Louis, but I moved to KC for school.
Michael Cusimano,
Perfect pronunciation. I'm in St. Louis at St. Louis University School of Medicine. Before that, I was in Springfield, Illinois.
Derek,
Hi, I'm Derek. I'm also at St. Louis University School of Medicine. And before this, I'm from Minnesota originally.
Rivathi,
Yeah, I'm from the St. Louis area, but I briefly lived in New York and Iowa, and I'm currently at UMKC for med school.
Bella,
Yeah, I go to St. Louis University, and I'm also from the St. Louis area originally.
Kenna, I'm skipping you. You're next on my list. Grace,
Hi, I am also at St. Louis University, originally from the suburbs of Chicago and did school in Iowa as well.
Sophie,
Hi, I'm currently at UMKC, and I was originally just across the state line from like Prairie Village, Kansas.
Joan,
Hi, I'm from UMKC and I'm doing I'm doing medical school at UMKC and I'm from Arizona. But yeah.
excellent. I'm gonna skip the folks who did not put their cameras on, just out of respect in case they're doing other stuff right now. But if you want to introduce yourself, just like make a noise or something. Um, awesome. Does anyone have any questions? I'm gonna hold on. Let me turn the let me stop sharing the screen. All right. No.
If you wouldn't be able to make it to the advocacy thing on in February because I have classes during that time, is there anything else we would be able to do?
Yeah, so there's a ton of things to get involved in. So the one in February is MOCEP's Advocacy Day. There's an MSMA Advocacy Day a little bit later in the year. If you give me 3 seconds, I'll tell you exactly when it is. Sorry.
I
Because that's
believe
the other
it's
one that's like,
March 4th or March 7th.
yeah, that sounds
Double
right.
check. It's
March
March
4th.
4th.
So yeah, so the Medical Society of uh so the Missouri State Medical Associations is going to be March 4th. So that's another one to get involved in. There's also so again, this is going to depend a little bit like on your school and things like that. But the AMA has a medical student advocacy day, which is coming up too. Um, when is the medical stu? So that one's March 6th to 7th in Washington, D.C. It's called MAC. And so that's a national one that's down in DC. I used to have a great time going to that when I was a medical student. Although back then they used to do it at the same time as the other doctors. Now they separated it out so they could do more programming specifically for medical students. But there's that one too. So those are the easiest ones in terms of just like plug and play, meaning you basically show up, they give you the issues, and then you go and get to talk to people. But there's a million other ways to get involved, but most of them involve sort of showing up and like going to be at whatever conference or whatever their things are. Those are the big advocacy days. Um, ASAP also has its own conference in DC, which is LAC, and I don't know when that one is off the top of my head. I
April
think that
27th through 29th. I'll put a link to that in the
awesome.
chat.
That is why you need an amazing executive for your society is so that they can help you and take care of all these things right off the top of their head as you're talking.
We just share a brain on these things.
Yeah. Yeah. So there's tons and tons of ways to get involved as a medical student. There's more when you're a resident, there's also lots of ways to get involved. Um, and then obviously you can stay involved as an attending one day if you want to. So either way, there's tons of ways to do it. Um, I think I'll tell you, so like my path was when I was a so Sarah told you I was a biology major and a philosophy major in undergrad, but my bio was a BA, not a BS, which meant that like I didn't actually have all of the prereqs for medical school. So I took 3 years off, during which time I took the prereqs, I took the MCAT. Oh man, you guys want to know how old I am? I took the last paper MCAT. So my MCAT was on paper. I had to like bubble in circles. It took like the entire day. It was like 1,000 people in like the ballroom of a hotel in New York City. It was ridiculous. Anyway, so I did all of that after finishing college. And I worked like on an ambulance for a little bit. I like worked in retail. I worked in a Toys R Us, like stocking shelves and like selling video games. Like I had a bunch of horrible jobs, um, all before medical school. But when I went to medical school, I was super, super excited. And the summer before, I got like a letter in the mail, not email, physical letter from my county medical society inviting me to join the AMA, the state society, the county society, and to like come to some barbecue like the first week of school. And so I immediately joined because I was like, oh, this is so cool. Like I'm a part of something real. Like I'm not just like doing nothing working as an office manager. Nothing against office managers. It was a horrible job for me because I'm not that detail oriented. Um, and so I was so excited to join. And then I went to medical school, and all of my friends were so caught up in medical school, meaning like learning the next thing for the test and studying. And like they were so caught up in school that it felt like no one was thinking about the context of medicine or what it meant to practice medicine or what our role was in society, trying to take care of patients and trying to make a healthier population. And so having that outlet through again, I was in New York, so it was the Medical Society of the State of New York, and through the AMA was super important for me to like be grounded and to be comfortable and to be happy because it let me do things that weren't just learning medicine. Learning medicine is super important. You're not going to be a good advocate if you're not also a good clinician, right? You need to understand those things, and I'm not trying to say you shouldn't do those things. They're really important, but most people need something else. Maybe you can be fulfilled by skiing, and if you can, that's awesome. Good for you. I can't ski. I tried once. I fell a lot. It was bad. But so like this is one of the things that I do to feel fulfilled and to like find meaning in my life. And like I said, I met my wife at one of these medical conferences, and now we have 3 kids. So it's there's a path forward for everyone. But if you're here at this meeting, you're probably like already in the cult a little bit. Like you obviously care a little bit about this stuff to like make the time out of your day to come join this call at 5:30. So I hope you guys stay involved and I hope you find ways to get involved. And if it's hard when you're a student, I understand that. It'll be hard when you're a resident too. But if you make the time, the national role for like residents who like all you have to do is show up, like show up to the national ACEP meeting as a resident. They will like put you to work. They will find things for you to do for the rest of the year. Like all you have to do is be there and you will get
Show
involved.
show up to any MOCEP event and we will welcome you with open arms, introduce you to anybody we can introduce you to that might be present. We do have our symposium and it is on Friday, May 2nd in St. Louis in Chesterfield. I'm more than happy to walk you around and introduce you to people if you are interested in attending that event.
Yeah. And I think I'm actually going to be at this one. So I've met the last few of the Missouri ACEP meetings. They've coincided with like an AMA meeting. And so I haven't been able to make it, but I think they moved it for me so that I can actually show up this year. So I'll be there. So come say hi. Like I'd love to like talk to you guys and catch up and find out what you're doing. Um, and I can always find a way to get you involved. I think the national level stuff. Obviously, I do things at the state level too, but I spend a lot more time at the AMA than I do anywhere else, just because I have like work to do there. Kenny, is there anything I left out, man?
No, I think if you're interested in emergency medicine, get involved. When I was a medical student, you know, of course, involved in EMIG and involved in health policy at the level of the Student National Medical Association. But whatever it is your organization is, get involved. Of course, emergency medicine has great organizations to get involved with. MOCEP is a great organization. We're definitely trying to restart our student council and encourage medical students to come to our conference in St. Louis in May 2nd, Friday, May 2nd, which I think will be a great way to get involved or at least see what we have to do in emergency medicine. There's the link. It's in Chesterfield, Friday, May 2nd. And yeah, get involved. I think getting involved early, staying involved, it brings a lot to your career and brings you a lot of enjoyment in your career. You have to have something else that you're going to do besides the medicine portion to keep you invigorated. So if you have any questions, of course, reach out to me.
And Dr. Chakwanu is our vice president, so he will be president of MOCEP starting next spring. And we do have some hands-on workshops at the symposium, so you'll be able to get a little hands-on experience as well. Again, the attendings love to see the students. They are always very eager to show you guys, spend a little extra time with you on the hands-on workshops, things like that. So please do not be scared. It's a very welcoming environment, and we hope that you guys will join us.